Change can be challenging for us as humans, and even more so when we are collaborating with a group to move changes forward. What are some of those strategies that we can use in our Nurse Educator program to make sure that we have the evidence to support the change? Number two, that we have a clear strategy. And number three, that we're able to execute and implement that change over time. In this snapshot, that's exactly what we're going to be exploring. We're going to talk about a case study. We're going to explore a thought-provoking question. And I want you to print out your study worksheet. If you haven't already, it's right here in the description. This is going to help you stay focused during our time together today. So you want to write down today's date, whatever date you're watching this snapshot. And then the second goal we have for the beginning of our time together is to write down the objective. What is it that you want to accomplish at the end of our time together today, or have more clarity about? On the study worksheet, we also want you to write down, what are your 3 goals? What are your 3 gap areas? Whatever's most appropriate for you depending on where you are on your journey, this is what we want you to stay focused on. Billings and Halstead Teaching and Nursing 6th edition is the textbook that guides our content. We develop our curriculum based on evidence-based recommendations from NLN, as well as data that we have gathered from nurse educator colleagues that we have supported on their journey as well. Now, if you're not on the journey to CNE, that's fine. Our goal and our mission is to help all nurse educators become better in the classroom. First, we want to start with some new data that was released back in March from the HRSA Health Workforce. Now, this is fascinating. Now, we all know that there is data that supports that we have a nursing shortage right now, and that's expected to get worse. This report says that at the national level, there are shortages projected until 2036. Now, take a look at this part. Specifically, there is a projected 10% shortage of RNs in 2026 and 2031. In 2026 and 2031, the next sentence says by 2036, the shortage is 9%. That is equivalent to 337,900 nurses. That's a whole lot of nurses. So why are we talking about this topic? Well, we know that we as nurse educators have to reimagine nursing education. The strategies that we've used in the past are shown to not be as effective. Let me give you one example. When it comes to lecturing, having a conversation about the learning process can be a challenge with students who are not connecting the dots, right? So if we have this wonderful teaching plan, but students aren't learning, then we're going to lose them. And what happens in nursing when we lose students in one class? You guessed it. It builds up over time and students become lost, and they often do not pass our course. So what is it that we can do? Well, first, we're going to start by talking about being a change agent and leader, and specifically, what are these competencies that are outlined in NLN, and how can we better support achieving these competencies? You can see here that it's domain 5, being able to function as a change agent and leader. You can see that there are about 8 different behaviors that are associated with this specific competency. Now, if you're not on the journey to CNE, or you are not on the journey to renew your CNE, then I realize that this information is probably not as relevant, at least the competencies, as for the rest of you. But this is what we know. Our ability to demonstrate these competencies helps create a better learning environment for our students, because that's what this is all about, right? We want our students to learn. We can't only focus on teaching, we have to also focus on the student's ability to learn. Well, how do we know that? Well, we engage in thought-provoking questions like we do here, and also we can use Socratic questioning or open-ended questions that allow students to express and clarify concepts that may not be as clear for them as we had hoped for them to be. So what does this look like? In the classroom, it looks like us having discussions. It also looks like us identifying those pre-class assignments with our students so we can start the learning process before they even enter the classroom. Another fact that we know about our students as adult learners is that they are not reading their textbooks. Now, I know these are not your students that we're talking about. We're talking about a large percentage of other students. So what strategies can we use knowing that a large percentage of students may not be reading our textbook? This is going to require us to be a little bit innovative and creative about how we connect with our students in the classroom. First and foremost, we want to explore other resources that are available, such as, even if the student doesn't have their textbook, there can be supplemental tools that our textbook vendors offer. Now, we're not going to mention any here because we know there's a lot and we don't want to leave any textbook vendor out. What we would ask you to do is just reach out to your vendor representatives to determine what resources do they have to keep students engaged in the learning process. Oftentimes, they have adaptive quizzes. They may even have unfolding case studies. They may have VSIM that is available to help engage students in that learning process. So that's step number one, is to use your resources and think about what are those obstacles that my learners are experiencing, right? Because we want to take a learner-centered approach as we think about strategies to better engage our learners, as we consider how can we engage in a change process that, number one, is sustainable, number two, that is evidence-based, and number three, that is going to have an impact. All right, so now let's go ahead and take a look at our content today. Now that we have explored all things about the competencies that are listed out by NLN, so first we want to take a look at what is it that we mean by change agent and leader. All right, so we're going to take a look at the competency in a little bit deeper detail. So here's the question, or is it a statement? As a nurse educator, what are those strategies that will effectively lead change? Now that's the question, right? That's that big question mark, effectively lead change. Well, first and foremost, what is our role? Our role is to foster innovation and improvement. We do that by being this change agent, initiating and managing change in a way that is going to serve in a leadership role where we are collaborating with our educator colleagues and we are inspiring them and guiding them, again, based on the evidence that's in the literature that we have already done our homework about, right? So we're bringing forward a change that is necessary based on data and based on evidence. What does the competency breakdown look like? Well, there are key leadership skills. There's three categories that we wanted to highlight. These are all essential. So first, effective communication. We want to listen in order for us to move change forward. We have to be active listeners. We want to be a visionary thinker. What does that mean? That we're listening, but we're also processing information about the details that we are hearing from our colleagues in order to execute on what our thoughts are, what our plans are, to truly see the vision through. Stakeholder engagement is this last very important category. Well, we want to move changes forward, but we have to make sure that the right people are on the bus and that they're in the right seat. Effective communication is going to be the cornerstone, really that foundation, right? It's going to guide us and keep us focused as we move forward. As we mentioned, that visionary thinker is going to pull data, they're going to look at trends, they're going to listen and take proactive approaches to engage with our colleagues about any challenges that may come up. And we want to think about what are our long-term goals. We know that there will be some short-term obstacles, but how do we get through those in order to achieve the goals that we as a collective unit have identified? And then, as I mentioned, that stakeholder engagement. Who do we want on the bus or at the table, and what seat do we want them to be in as part of that change that's moving forward? Next, we want to consider our thought-provoking question. All right, so tell us what you think about this one. Write it down on your study worksheet, or you can put it in the chat if you're watching this live. So a nursing school is considering implementing a new simulation-based teaching method, but faces resistance from faculty who are accustomed to traditional lecture-based approaches. Now, I know none of you all can relate to this scenario. The administration must decide how to address the resistance while ensuring the new method's successful adoption. How should the administration address faculty resistant to implementing simulation-based teaching methods? All right, so we have three choices. When you get to the C&E exam, you want to think about two things. Number one, what is this question really asking me? And number two, what is it that I know for sure about content related to this question? So our three options are: develop a plan to mandate the new teaching method, emphasizing the importance of compliance. Number two, to engage faculty in the decision-making process by forming a committee to discuss the benefits and concerns related to the new method. And then third, offer incentives for adopting the new teaching method and provide comprehensive training and support to all faculty members. What do you know for sure? And what is it that you feel like you can eliminate out of these three options? And of course, what is the question asking me? All right, so go ahead and write that down on your study worksheet, or if you have the study workbook, that's great too. So write down what you think is going to be the correct option, and in our wrap-up time, we'll go back and look at the best option. Okay, so here's our case study. We're doing something a little different. All right, so the background is we have a nursing program that is faced with challenges related to outdated curriculum and low student engagement. So what are your next steps? Well, in this scenario, a new dean implemented a comprehensive curriculum overhaul and introduced active learning strategies. Now, I want you to think about who else should be at the table with this dean. What data should be collected in order to decide which component of the curriculum needs to change? And then third of all, what are those key steps to making sure that we are identifying what active learning strategies should be introduced? We know that things change over time, right? 30 years ago, overhead projectors was a key way to teach. How many of us remember those overhead projectors? That's right, where you saw the back of the faculty member for most of the time. Think about where we are today, and we still have advances and innovative teaching strategies that we still have an opportunity to take advantage of. There are always new and exciting teaching strategies that help us engage our learners. We always want to make sure that we're not only engaging in something fun and exciting, but we want it to be aligned with our learning objectives and with what we want our outcomes to be. All right, and what else is it that we know about a process change that we want to move forward with, such as the one with this case study? Well, we want to look at the results. Did it work? Okay, and it did, right? Because we know the outcome is that we have increased student satisfaction, we have a higher NCLEX pass rates, and we have improved faculty morale. Well, we would want to see quantitative data as well, right? We would want to see the data points before and after the intervention that we move forward with. So this is just an example of a case study that you can engage even your students or colleagues with to make sure that you are closing those knowledge gaps, that you're bridging that theory practice gap. Unfolding case studies is a wonderful way to engage even our colleagues as we're moving change forward, but also with our students, because we know they have to engage in changes too. We can have the best plans laid out for our students, but sometimes we have to pivot and make adjustments. So this is a summary. The initiative, we've talked about the dean implementing that comprehensive curriculum overhaul and hopefully having colleagues at the table. And the outcome, everything improved. And then what is our lesson? Well, we want to engage in a successful change strategy by being clear about our vision, having stakeholders engaged, so having a seat at the table for our stakeholders, and being able to see that change continue, right? We want to persevere. We want to push through those challenging situations, thinking about what our common goal is. All right, so to wrap up our time together today, if you chose B, you are correct. So give yourself a round of applause. Engaging faculty in the decision-making process, forming that committee so we can have seats at the table, we can talk it through. It doesn't mean that we're going to agree on all of the points, but we want to agree to disagree and move forward with that change. A, anytime we see mandate, we always want to consider, is that the best approach? And then for C, if we offer incentives, there could be feelings, negative feelings that some may have, some faculty may have, of favoritism or rewarding faculty who are willing to buy in, right? So we wouldn't want to create that type of culture. We hope that this snapshot has been helpful as you think about what are your strategies going to be to move forward with that change. We would leave you with 2 points to remember. Number one is to gather the data, right? Gather the evidence that supports that change moving forward. And number two, making sure we collaborate and coordinate with our colleagues to move that change forward. We want to sit at the table. We want to talk it through. Look at the evidence, and then we want to execute, moving forward with that change that's sustainable, moving forward through those challenging situations to improve the learning experience for our students and also the environment for our faculty. We believe these are all strategies. Now we can put an exclamation mark behind it that can effectively lead change. We look forward to seeing you in our next snapshot.